30,198 na ang nabigyan ng COVID booster shots sa bansa.
Isinusulong ni Presidential Advisor at Entrepreneurship Joey Concepcion ang no booster card, no entry.
Booster shot kontra COVID.
The pandemic is not yet over. The virus continuously transpires, causing detrimental incidents.
Due to this, COVID-19 booster vaccines are administered to combat such a virus and impede its impacts.
However, despite their efficiency, booster vaccines are still doubted by many, leading us to question how does booster vaccine hesitation occur and what are the factors that lead to such a reluctance.
We are from Grade 12 AY, and this is the overview of our study, Hesitation and Refusal Factors of Senior High School Students of General Mariano Alvarez Technical High School regarding COVID-19 booster vaccination.
The threat imposed by COVID-19 variants has prompted many countries to start administering booster vaccines. Booster shots are the additional doses administered following the primary dosage of COVID-19 vaccination. It is used to strengthen the immune system and provide further protection against COVID-19 and its variants, making it significant in the current situation. Several studies have shown the significant efficacy of booster shots, specifically how it increased the immune response of individuals against hospitalizations.
Further, an observational study among fully vaccinated nursing home residents showed that COVID-19 vaccine efficiency dropped from 74.7% to only 53.1% in a few months. Due to the emergence of novel coronavirus disease variants, developed vaccine may be unable to protect individuals from these diseases, leaving them vulnerable to its dangers. However, despite the substantial evidence of booster shot efficiency, vaccine hesitancy remains a prominent concern and challenge to booster vaccine uptake. While booster shots are highly recommended to increase the immune response to COVID-19 virus and its new variants, individuals remain hesitant to receive such additional dosage.
The World Health Organization has listed vaccine hesitancy among the greatest threats to global health and calls for research to identify the factors associated with this phenomenon. In the present, the latest retrieved data from General Mariano Alvarez Technical High School shows that 3 out of 1,972 grade 11 students have received booster shots. Following this, 10 out of 1,277 grade 12 students have taken their booster shots. With still the low number of COVID-19 booster vaccinated senior high school students, the institution strives to advocate vaccination to ensure a safe learning environment. In accordance with this, it is crucial to examine booster shot hesitancy and its associated factors to effectively promote the uptake of COVID-19 booster vaccines. The present study thus seeks to understand the hesitation and refusal factors associated with the vaccine hesitancy of senior high school students of General Mariano Alvarez Technical High School regarding COVID-19 booster vaccination. Consequently, interventions and strategies to support the institution and local government to advocate vaccination of COVID-19 booster among students are to be identified, presenting significant implications for public health during the present and future pandemics. As booster vaccinations become extensively available, hesitancy among individuals remain a prevalent conflict. The study delved into the present booster vaccine hesitancy displayed by individuals. It further examined the foremost refusal factors that led to the prevalence of vaccine hesitancy in the community. These factors include variables such as vaccine side effects and extent of risk, lack of knowledge regarding the vaccines, hesitation of individuals to be inoculated first than others, complacency, and confidence. Further, the Department of Health in 2022 reported that Philippines Filipinos believe they already have sufficient protection against COVID-19 upon being fully vaccinated and due to the natural immunity from coronavirus infection. With such factors, hesitancy and denial of booster vaccine uptake transpire.
In a recent report in the Journal of the American Medical Association Network 2022, the incidence of SARS-CoV-2 was 116 per 100,000 persons per day before booster vaccination and 12.8 per 100,000 after booster vaccination, for an estimated relative reduction of 93%. This is incontrovertible proof of how not having a COVID-19 booster vaccination impacts the waves of the virus incidences. This serves as evidence in the international arena of how pivotal the COVID-19 booster is in mitigating cases rollout.
Various literatures suggest different strategies to combat this prevalent concern. According to Bath and Nakasi 2022, there are 5 things to know about booster vaccination and strategies to take to increase booster uptake. Increase awareness, knowledge, and dissemination of accurate vaccination information, enlist and empower trusted messengers, normalize boosters as an expected and routine part of vaccination, expand booster vaccination access, and focus on building trust among individuals. Further, structural obstructions, including political issues and poor implementation of health services that further contribute to vaccine hesitancy, highlight the importance of societal influences such as media, government, and health personnel, not just specifically in COVID-19 vaccines, but as well as booster vaccines and vaccinations in general, as they are the ones that people rely on in such situations. Thus, adequate encouragement, such as providing a sense of belonging to individuals, particularly those from the marginalized sector of the society, could be a significant stepping stone towards vaccination acceptance and eventually vaccination uptake, particularly with booster shots.
In conducting the study, we followed a quantitative research design, specifically a cross-sectional surveyed study. Following this research design helped us to collect necessary data from respondents in a brief period of time. Such a design is profoundly suitable in identifying the hesitation and refusal factors that influence the booster vaccine hesitancy among students, hence appropriate in answering the research problem. As the research seeks to identify the hesitancy and refusal factors displayed by senior high school students of General Mariano Alvarez Technical High School, the target population of the study is bona fide senior high school students of the said institution. Students must be fully vaccinated with COVID-19 vaccines, yet have not received any booster shot to become eligible respondents of the study. As of April 11 in the year 2022, the retrieved data from the Office of the Admin Clinic of General Mariano Alvarez Technical High School shows that 1,154 grade 11 students and 848 grade 12 students are recorded as qualified participants of the research.
In order to arrive at our conclusion, we used only a portion of the population by identifying the sample size, with the use of the Slovin's formula with a margin error of 10%, which resulted to a sample size of 96 respondents. To organize the sample size, we utilized the stratified sampling technique to identify the numbers of respondents from grade 11 and grade 12, which resulted to 55 students for grade 11 and 41 students for grade 12. In collecting data, we used survey questionnaire as a device consisting of a series of questions related to hesitancy and refusal factors toward booster vaccination. The survey questions were classified into 3 sections, wherein each section focuses on a particular research variable.
In data gathering procedure of the study, we performed 3 steps to secure an accurate and ethical data gathering. Preparation stage was done first, and this includes the construction and validation of the survey questionnaire. Following this was the data gathering stage, wherein the actual survey was executed. Lastly, the data analysis stage, where the collected data were tabulated, computed, analyzed, and interpreted to arrive at accurate conclusions. For the statistical treatment of the study, we used the percentage distribution formula as our statistical tool for data analysis and interpretation.
Following the conducted survey, the collected data are displayed in tables and interpreted to determine the hesitation and refusal factors of senior high school students of General Mariano Alvarez Technical High School regarding COVID-19 booster vaccination. For the respondents' profile, Table 1 provides an overview of the percentage distribution regarding the grade level of respondents from General Mariano Alvarez Technical High School. As shown in the table, a total of 96 respondents participated in the study, the majority of which were grade 11 students, 57%, whereas the grade 12 students were the minority, 43%. Further, a total of 55 grade 11 students and 41 grade 12 students completed the survey questionnaire, which translates to a 100% response rate. For the results of Section 1, Booster Vaccine Hesitancy, a table is to be presented. Table 1.1 summarizes the percentage distribution regarding the COVID-19 booster vaccine hesitancy displayed by senior high school students. To report the majority of the responses, 44% of the respondents agreed that they believe that booster vaccines can protect them from COVID-19 and its new variants. 36% of them neither agreed nor disagreed that they will have themselves booster vaccinated against COVID-19. Further, 33% of the respondents neither agreed nor disagreed that they are reluctant or hesitant to get COVID-19 booster vaccination, and 43% who neither agreed nor disagreed that they refused to get COVID-19 booster vaccines.
For the results of Section 2, leading refusal factors of the survey questionnaire, there are 3 tables to be presented. Table 2.1 summarizes the percentage distribution regarding the refusal factors influencing the existing booster vaccine hesitancy of senior high school students. The 3 leading reasons gathered from the respondents as to why they are hesitant to get COVID-19 booster vaccination was the negative information they have heard or read in media, concern about the booster vaccine's safety and side effects, and influence of others regarding their bad reactions upon taking boosters, which garnered 42%, 34%, and 31% respectively. Table 2.2 presents the overview of percentage distribution regarding the refusal factors influencing the previous booster vaccine hesitancy of senior high school students. The 3 leading reasons gathered from the respondents as to why they were hesitant to get COVID-19 booster vaccination was the negative information they have heard or read in media, not relevant, and concern about the booster vaccine's safety and side effects, which garnered 38%, 32%, and 32% respectively. Table 2.3 presents the percentage distribution regarding the reasons why senior high school students are booster unvaccinated at present. The 3 leading reasons gathered from the respondents were they are not sure about the long-term side effects of the vaccine, they cannot find the time to go or the lines are too long, and they do not qualify to receive it, which garnered 38%, 23%, and 21% respectively.
For the result of Section 3 interventions, there are also 3 tables to be presented. Table 3.1 summarizes the percentage distribution regarding the factors that took off senior high school students' booster vaccine hesitancy. The 3 leading reasons gathered from the respondents as to why are they hesitant to receive COVID-19 booster vaccines was because they are consulted by their family and friends, not relevant, and because they did more research, which gathered 40%, 39%, and 31% respectively. Table 3.2 summarizes the percentage distribution regarding the factors that will help senior high school students become more inclined to take booster shot. The three leading reasons gathered from the respondents as to what type of information regarding COVID-19 booster vaccination would help them to be more inclined to take it was because of how effective booster is, side effects of the booster vaccines, and impact of the vaccines on their overall health, which garnered 60%, 57%, and 41% respectively. Table 3.3 summarizes the percentage distribution regarding the factors that influence senior high school students not to take COVID-19 booster vaccination. The three leading reasons gathered from respondents as why their decision not to take COVID-19 booster vaccination was advice of their family or friends, not relevant, and information they saw or heard in social media or mass media, which garnered 49%, 35%, and 27% respectively.
Despite the substantial evidence of booster vaccine efficacy, vaccine hesitancy among individuals remains a leading challenge to booster shot uptake. In order to address such a critical concern, the present study aims to investigate the hesitation and refusal factors of senior high school students of General Mariano Alvarez Technical High School regarding COVID-19 booster vaccination. To identify whether students display a significant booster vaccine hesitancy and its probable leading factors, we devised a survey questionnaire divided into three sections, namely Section 1, Booster Vaccine Hesitancy, Section 2, Leading Refusal Factors, and Section 3, Interventions. The survey forms were distributed to 96 research participants, which 55 of them were grade 11 students and 41 were grade 12 students.
Upon the completion of the study, we were able to conclude that there is a significant COVID-19 booster vaccine hesitancy displayed by senior high school students. Further, the leading refusal factors that contribute to COVID-19 booster vaccine hesitation of senior high school students are the negative information heard or read in media, vaccines' side effects and extent of risk, and the influence of others. Lastly, increasing awareness, knowledge, and dissemination of accurate information regarding booster vaccination, enlisting and empowering trusted messengers, expanding booster vaccination access, and focusing on building trust among individuals are effective strategies that may support the institution and local government to promote vaccination of COVID booster among students.
For our recommendation, the COVID-19 booster vaccine hesitancy among senior high school students can be eradicated through the following recommendations. The local government unit of General Mariano Alvarez, Cavite shall implement programs, projects, and activities, PPAs, to help not just the outer sphere of influence but also reaching the core of the community to build a good encouragement for the students to have their booster vaccine. As per the patent data resulted in this study, the beloved institution of General Mariano Alvarez Technical High School shall establish a good foundation of knowledge among senior high school students to obliterate hesitancy on getting a COVID-19 booster shot and expand the cognition vis-a-vis its upsides, especially in these times of crisis. The future researchers can further expand the scope of the study and understand other hesitation and refusal factors on a wider scale and from a different view of various sectors.
Following the course of the study, we understand the importance of booster vaccines in our fight against the pandemic.
These vaccines ensure our protection and help us to be responsible citizens of the community.
Henceforth, let us be booster vaccinated and be of great help to attain herd immunity.
I am Ishie Mae Asonto.
I am Aikee D.
I am Lorenz Amoranto.
And this is the overview of our study, Hesitation and Refusal Factors of Senior High School Students of General Mariano Alvarez Technical High School regarding COVID-19 booster vaccination.